Limpopo province has seen several road accident fatalities. The province, as you know, yesterday welcomed 40 Christmas babies. Among the mothers were 8 teenagers between the ages of 14 and 19, which has become, or at least has been, a matter of concern across provinces. On Christmas morning, the province also experienced the tragedy of 7 family members who were shot and killed in an alleged family dispute. The suspect is reported to be a health department official in the province. For updates on these developments, we speak to Limpopo Health MEC, Dr. Phophi Ramathuba. MEC, thank you so much for your time and thank you for joining us.
Morning, Doc, and morning to all your viewers out there, and Merry Christmas to all of you, and thank you for inviting us.
Indeed, and thank you for the well wishes, but it is, of course, falling on a pretty somber day as well, noting the passing of Archbishop Desmond Tutu. Please do share with us, I suppose, your reflections on the significant, momentous moment. I would say a profound loss for South Africa.
It is indeed a loss for us as a nation, as a country, and as a continent and globally. We know we have lost a colossal, a great individual representing humanity, because the Ark was humanitarian by his nature. He cared not only about his own personal health. If I am to be coming to my sector, we will know his struggles, and as a medical student and also as a junior doctor during the time of issues of HIV and AIDS, how he advocated for patients at that time. And each time you deal with any other pandemic within the health sector, the Archbishop was very instrumental and very much supportive. To him, it was about health being a basic human right, and no one must be denied access to health care because they would not have the size of pockets that could be able to afford the type of healthcare system he wanted. And I think in his memory, those of us who are in this industry, in this sector, we should fight to make sure that until every single South African have access to quality health care, until whenever you are hit by any pandemic, whether it's HIV, whether it's COVID-19, each and everyone must have equal access to treatment, care, to vaccines, immunization for our children. And I think in that way, that's when we will be remembering him. And of course, all other humanitarian issues, issues of people getting basic services, your house, your electricity, your water, your sanitation. I mean, those are the things that if we really want to honor him, we must make sure that not single South African go to bed being hungry. And that's why I'm saying we have really indeed lost a person who was humanitarian by nature.
Indeed, MEC, I think a lot of us, when we do reflect on the life of Archbishop Emeritus Desmond Tutu, we're likely to think of the clergyman, we're likely to think of the man, the voice of reason, who encouraged South Africans to walk down a path towards reconciliation, when really the country was a tinderbox for violence and chaos and insurrection. But, you know, one thing we also forget is that alongside the many sort of titles he may carry, one of being an anti-apartheid activist, he was also a human rights activist. And I think recalling the championing that he, made at the height of the COVID-19 pandemic, encouraging South Africans to take vaccinations at the height of a lot of uncertainty around COVID-19 vaccines, I think that allows us to remember that he was at the core of him a human rights activist too.
Exactly, this is what I'm saying to say. He never wanted to see any South African not having justice, not just South Africans, but globally. He was a human rights activist in his own right. And of course, the role that you are sharing with us now, that he played for us during our reconciliation, how much he had so much influence on saying on the issues of forgiveness and moving forward. I think we really need to appreciate that. But what is more profound for me is that post-apartheid, he never sit down and fold his arms. He still continued to make sure that South Africans continue to receive what they deserve. Like you are rightfully saying, for me, in the health sector, there is no single pandemic that we dealt with, or any epidemic, whether it's malaria, whether it's HIV and AIDS, that you would not see him making a contribution to say people deserve to get the ARVs, irrespective of who they are. And he was not afraid to take us as government head on. He was not afraid to speak truth to us, truth to power. So you really need such type of people who would challenge you so that you can keep on track in whatever work or whatever responsibility you are doing, because you can't have praise singers if you really want to transform your government. You need that voice of reason. You need that voice of the voiceless. You need that voice that speaks to those who can't speak for themselves. And hence I'm saying the poor and the poorest of this country have really lost that particular voice of hope to them.
Indeed, a presence that we will certainly continue to feel on even after his passing. And thank you for helping us to recall his contributions in terms of just health advancements in this country, in terms of treatments for HIV and AIDS, and assisting us to really destigmatize a lot of the myths around the virus at the time. But MEC, we have invited you onto the program to discuss the state of healthcare in your province, particularly around the Christmas period, particularly around the holiday period. There are a number of factors, of course, that are coming into play during the season. Can you give us a quick overview of the state of healthcare in your province up until today?
Yes, indeed, it's a very difficult time for us as a province. It's something that we anticipated, because at the beginning of this month, when we were doing our own plans for a disaster period, we saw even the number of trauma escalating, and that's why we had to put up more systems. Yes, in a very difficult period, because one, we are hit by the fourth wave, even though we see hospitalization not the same as what we saw last year or with the previous 3 waves, which credit must be given to people like to that we are talking about, our bishop currently, our archbishop, who was one of those first senior citizens who took the vaccines publicly, and we must appreciate that, because most of our senior citizens, especially in our province, who believe in bishops, who believes in church leaders, they went in their numbers to come and join us and get vaccinated. You have seen even in our province, our own bishops who are also elderly, they were the first among the queue to join and get vaccinated. So we give credit to them. That is why today we do not have the high numbers of those who are admitted, requiring oxygen, requiring ventilation, and requiring warm bodies to look after them. Because currently, even the very same warm bodies, our health care workers, there are many who are testing positive, which of course the good thing which is comforting us is that equally they are not sick. Most of them are not even symptomatic. That's why most of them are even putting up their PPEs and volunteer to say we can't stop working because we have tested positive, because we are not even symptomatic. We tested positive because we have been contact of those who tested positive. But we must still indicate that there are those who are on isolation. Hence, we are operating with a very few skeletal staff. It's festive season. We had hoped that this time around we'll be able to release most of our staff to can go and take a break and rest, so that come January, when they come back to work, they should also have refreshed or have rested. But unfortunately, because of all these other trauma accidents that are going on, especially as a result of alcohol abuse by our people, it's making it difficult for our healthcare workers to can even have a rest. And this will put a serious strain on the very same health system. Because if I'm to be honest with you, Tokos, our very same nurses that we are using in the COVID ward, these are the nurses who, when the wave give us a breather, we release them to go and assist with the vaccination. Currently, we wanted to say, let's give them a break on the vaccination and allow them to rest. But we can't. We must bring back them to the hospital because there are those people who are not vaccinated. We're now starting to see numbers of hospitalization. It's mainly those who are not vaccinated. I must be honest with you. The vaccines are working for us. Those who refuse to be vaccinated are clogging our system.
MEC, it's been interesting to note that KZN, of course, is reporting a surge in COVID-19 cases. Something that has been noted as a contributing factor is, of course, the fact that we are in now festive season. We've seen numbers of people flocking down to the coastline. This is, of course, congesting the area. And I wonder if something similar, or at least if there's a concern that something similar could be happening in Limpopo, where we are seeing holidaymakers during this Christmas period, going into the New Year's, making their way, back home. Are we likely to note a surge in cases a few weeks from now, perhaps?
I think as a province, we've done a lot of work in terms of educating our people, even our guests. We're not afraid of being controversial according to the public, even in terms of our messages. We've been very clear. If you are working somewhere, because this time around, the Limpopo province, for different reasons of KZN, but mainly one, most of our people, especially the young and economic active, they usually during the whole year spend it outside the province looking for greener pastures. That's where they are working. So mostly this time around, they are coming back to spend time with their family. And that is why you stand a chance of them having to be probably infected and not even being aware and come and infect. We saw it happening last year. But this time around, we have been very upfront. You saw us, we've been on the N1 road as Limpopo government with our MEC for community safety led by our own premier. We even provide vaccines on the toll gates, vaccines on the roadblocks, vaccines all over, because wanted to remind those, so you are coming here to the vulnerable in the rural areas, please try to get vaccine before you get there. The second issue is that most of the people chooses our province for tourism as a tourism destination. Those who do not want to visit the beach, they know they will want to visit the game farms, and they know Limpopo is where you will find the big five, and they will come here. Hence, we're working with the tourism sector in our province and the Department of Economic Development also to really make sure that even our tourism sector, they are well prepared, they are well trained, we vaccinated them, their staff. We even took vaccines to all our lodges, all our game farms, and educate them to say how can they encourage even their guests.
Right.
If they've got a number of guests who are not vaccinated, they even contact us and we go there and provide them vaccines. So based on that reason, because I think as a province, we do not expect so much huge changes as compared to what we saw last year. We are hoping that our people have heeded our call and they are going to comply in terms of COVID-19 regulations. But we can't rule it out to say there are those, not everybody has agreed or accepted to be vaccinated. There are still those who don't believe that the vaccine and the virus exist.
Okay. MEC, thank you so much for your time and thank you so much for joining us. That was Limpopo Health MEC Dr. Phophi Ramathuba giving us the latest there in terms of the state of healthcare in her province.